هلا
وين lady is gentleman.
والله تنفع من تخوف يا اخي.
دخلة قوية. Our case about one case of Emad. Actually, we have, to be honest with you, I went to medical records looking for this file. I didn't find it. For that, I traced it in Medical Plus. But the point is that
You mean أول visit? The first
the
visit.
first visit.
طبعا مشكلة هذه والله.
Only one visit to our hospital.
لا two visits.
Two visits.
الأول جاب DVT وسنت هون، الثاني diagnosed DVT. هلا الفيزيشن خاف ومسك الشارت الأول وإيه؟
يعني I cannot
أقول لك يعني صعبة unlike بس هذا هو الشيء اللي يخوف.
I can't say that because I found in the medical records a big mess. Actually, I didn't find the files well arranged, but I found it in big piles, huge piles, and we have to trace in about 10, 15 piles or boxes, big boxes like this. Anyway, I traced in the Medical Plus and I found some useful data, but the point is that we missed the physician impression about the case itself. This is
إيه
what
مشكلة.
we missed.
How to avoid this in the future.
Anyway, this patient was 66 years old, a female patient known to have bilateral breast CA, not on chemo. She presented to ER on 1st of October, complaining of fever, warm swelling, and redness in her left upper limb.
Why nobody will think of DVT once we hear a
Cellulitis.
no fever يعني.
Fever with the swelling and the redness. Temperature was 37.9, blood pressure was okay, heart rate 103. Apart from this, the rest of the vitals are normal. As Dr. Sami said, nobody will think about DVT, especially that the labs came to show leukocytosis.
هذا اللي يحترموا الليوكوسايت ينتبهوا. ترى DVT could elevate leukocyte. أيوة.
She was diagnosed as a case of cellulitis and she was given augmentin.
عرفنا اللي يحب الاوجمنت. في واحد يحب الاوجمنت بالطوارئ.
كلنا نحب
discharged.
بالله؟
ايوه
انا ما عمري استخدمته بحياتي، ما ادري ليش.
واحنا كلنا نستخدم اوجمنتين
يعني ممكن انت يعني.
والله.
اي تفضل.
بس انا ما خرجنا جديدين.
I found it very effective. يعني.
اوه انا اكسلنت دراج.
انت بتدافع عن نفسك يعني ولا بتدافع عن مين؟
Actually, I defend this physician because if I were in his position, I would think.
اوه انا كمان ترى if I wasn't I might think to send her home.
مين
Did
الفيزيشن؟
he did ultrasound?
لا لا.
No.
He is
This
giving
occasion-
signs and symptoms of inflammatory process. It's not
فهذا هو
vascular.
أصلا.
It's all inflammatory process.
وايت كاونت 21 وجايب فيفر وكانسر وريدنس يعني 99% سيلولار. بس يظل 1% DVT.
This is very common in our practice, and actually we faced it several times.
ترى رمضان مشكلة.
Anyway, this patient came again after 3 days. She presented to ER complaining of increased swelling and redness, but no more fever
خلاص أخذت antibiotic.
because she is on augmentin and paracetamol. Temperature 37, blood pressure is okay, heart rate was came down, and other vitals are normal. She was at that time, I don't know why they started to think about DVT, so they started
خلاص second visit هذه. Not getting better هذه
After
سهلة
3
هذه.
days.
هذه سهلة. واحدة ما تحسنت والليفل is getting more swelling يعني ما هي صعبة.
لازم يصير له.
هذه لازم افحصها. وش لم اي واحد كان؟
ليفت
وهي عندها بايلاترال بريست. ايوه صح.
left upper limb. Doppler came to show brachial venous thrombosis. She was referred to oncologist and on admission she was maintained on coloxane and antibiotic continued IV. After 5 days she was discharged from the hospital. Now as you told me that we have to find out what is the dilemma between the cellulitis and DVT.
نعم.
أيمن.
اللي فيه.
نعم عشان تحسب نحن.
I went to,
good.
this is Wael's criteria. Actually, I found that it is designed for the lower limb DVT, but anyway, we can get some information, some guidelines to help in upper limb DVT.
طيب أول فيزت كم ويلز حقها؟ مين هنا يلا فهد. أول فيزت لما جاء ب subjected fever but 37.9 صح؟ أول فيزت. قديش تحط أول؟
انت مالك سنه 3
رقم 3 عندي.
يعني واليوز كان والله من أول فيزت.
لا
لا بس عندها انتين لبس وينس.
هذا كان
يعني على حسب الجماليش
تندرس فيه؟
صراحة يعني
ريدنس
يعني تطلع 5 تقريبا.
5
يعني 5
يعني تعمل التراساوند صح؟
ما اعرف انا what to do after calculating the number. حطيت جدول.
لا أنت once you
كم 5 على طول moderate high.
اوكي 5 هذا more than.
هنا يقول لك more than 1.
more than 1 معناته likely خلاص.
likely.
وين يعني
هي لسه still إنه between 2 and
لا كيف more than 1؟
هذا
قصده more than 5 قصدك. unlikely less than 2.
الموديفايد هذه كرايتيريا شكلها.
بس likely more than 5. غلط في غلط في بعض.
anyway between
لا انا اعتقد صح.
في موديفايد دكتور.
likely more than what؟
في
وكيف unlikely less than 2؟
لأن لا تضعوا إنه ما له داعي واحد يحط أصلاً ويز كرايتيريا.
أنا ما استخدمه بس عشان إنه يجاوبه.
في موديفايد كرايتيريا.
Which test you mean here by pre-test clinical program?
هذا ولد.
والله.
Wael's criteria. But anyway, Wael's criteria, especially in the upper limb, يعني we cannot relay
والله صعب
totally.
لأنه ويلز كلها على
lower
DVD.
I went to other sites here in e-medicine. Mediscape.
والله كلام كبير يقول لك patient with DVT often develops secondary cellulitis while patient with cellulitis often develops secondary DVT. يعني اللي عنده cellulitis at risk of DVT واللي عنده DVT might appear as a cellulitis. يعني Doppler everybody يعني.
And this study especially in our patients and those with comorbidities and high-risk patients, especially like our patients with onco patients. Here it is EB medicine
يقول لك difficulty distinguish cellulitis from
from
DVT.
DVT stems from the tendency of cellulitis patient leg or arm to appear swollen from the edema secondary to localized infection. This edema and the swelling in turn causes discomfort when an examiner squeezes the leg or arm. Laboratory tests may not be specific enough to help differentiate the two disease entities adequately. In fact, that furthermore, the white blood cell count may not be elevated in cellulitis. It may not be elevated in cellulitis, and it may be elevated in DVT. So white blood cells will not help too much in differentiation because it may not be elevated in cellulitis.
If you insert a two steps can increase white cell
Yes.
count, so anything can even hyper sugar.
Even before the exam, check your WBC.
20.
يعني 18.
Now, what do you think about one sign in the clinical examination by the definition of cellulitis?
Which is?
The area of erythema will be irregular, shaded, localized.
Localized, well, it's a diffuse cellulitis will be different.
All study fail to differentiate.
It goes by definition of
I
cellulitis.
know. All study fail to
DVT
differentiate
make entire-
DVT from cellulitis.
DVT make entire all limb swelling.
If it's a major DVT, if it's a major DVT, well,
والله يا ايمن if she came to me the first اطلع على السكن انا سويت لها التراساوند عشان جاتني سكن فهمتني؟ نو
يعني أنت اللي
لا سكن
no, my question is,
المكنه شكلها
can it shall
أنا سويت لها التراساوند لأنه جابني
أي طبعا هي أهم
It was initially
واضحة
cellulitis and DVT
مو
developed.
سويت لها اشوف دي في دي
Could be.
حتى كنت شكلها نورمال وتطلع البيت
سبحان الله.
The point
question
of
is-
Dr. Said is very valid.
ايش؟
The patient, Dr. Said explain what you feel.
My question is, was it to start with just cellulitis and DVT develop secondary?
It might be yeah.
Could be.
And this is what he said. DVT could be complicated by cellulitis because the decreased venous and the area might get
And
infected.
vice versa. It's a
And
process
vice versa.
It's a process of
So it's difficult to differentiate and it's difficult to prove that this one happened after the other. So, in our setting where we have access to Doppler, should we scan everybody?
Well, on the high risk.
Or should we select?
No, no,
Why we don't
Let us get
understand?
one more study.
Yes.
Here, vascular web. DVT can cause sudden swelling, pain, or a sensation of warmth. So the patient himself may complain
Of subjective fever.
of subjective. DVT can be dangerous, you know the rest of it. Let us go to another study. Here, this is American Heart Association. Upper extremity deep vein thrombosis is an increasingly important clinical entity.
معلش كان عندك كاثيتر؟
لا.
الحمد لله. لأنه لو كان عندك كاثيتر definitely she has to be a Doppler.
But,
Are you sure?
sure.
هي ما قدرت
But they considered and they stressed that intravenous line, intravenous cannula,
أيوه.
and the affected limb, I mean the side of mastectomy, could be a risk factor. This patient has bilateral mastectomy,
Yeah.
so we have a risk factor.
Wherever you put the cannula, you're increasing.
So this is American Heart Association focusing on DVT in upper limb, saying that it is more increasing nowadays, and it came to be, it is evolving as a clinical problem nowadays. Also, American Heart Association saying physical examination reveal low-grade fever attributable to thrombosis.
Thrombosis of
كان
ما شاء الله. صعب علينا الوضع.
تصير في
حتى البي ممكن يجيب فيفر وتقول إنها نيمونيا
اي واحد يجيك بفيفر
So,
وسويلنج
by the end, the conclusion from all these studies, I came to that patients with a warm, swollen, tender extremity should be evaluated for both cellulitis and DVT together. Because patients with primary DVT often develop a secondary cellulitis, and patients with primary cellulitis often develop
Especially with
عشان كده طلعوها البيت كومبلكسين and antibiotic.
No, especially with the well score of more than one. So all our patients are more than one. The malignancy itself is at 3.
Malignancy is 3.
So modern teaching is that if I'm not wrong, more than 1 or 2 well score is
Enough.
to treat as a DVT and to prove otherwise by doctor.
The message here, we have to take a decision on those patients.
Yeah.
Should we scan them all or not? How many cellulitis we see?
والله if it is malignancy
No, well score.
كله عندنا
خلاص.
نتكلم عندنا ما نتكلم عن التعليم نتكلم
هم صراحة
عن
شوف if you didn't scan الأونكولوجي بيصير لها سكان
ايوه نعم
على طول أي حتى لو سيرولات
وما سوى سكان جات الدي
اي لا هو يسوي سكان ترى.
لا نبغى
خلينا احنا اللي نكون
do we need to formulate a policy or let it up to the physician
I think up to the physician.
but some physician will oh no cellulitis home
اتوقع انه في اشياء ما يحتاج يسوي فيها بوليسي كانت
قول.
في بوليسي.
طيب انت قول
There is a
تجي
critical
تو
side.
فيزيشن احسن.
we will face this next time صح؟
There is a critical decision will be taken here.
Fine,
Whether
good.
to anticoagulate the patient or not.
Yes.
So, the
Doctor.
patient- yes, the patient should have it.
so Doppler everybody
Yes.
any worm
No, no.
شوف المسج واضح any worm
swollen tender.
swollen tender extremity you cannot differentiate
Yeah, that's what I said, that well score is, you can have, doctor mentioned well score is above
Yeah,
3,
we
you
or,
are
or
right.
our patient will score above 5
So that's automatically you need to rule out this. It's a different.
so you're with Doppler those patients
Yes.
with warm tender
Yeah.
swollen extremity
This simple treatment
But do we
pathology.
need to put it as a policy?
what do you think guys
I think no need to put it as a policy. We should just educate all the doctors in the department. This is-
we make education and have
Nobody is
don't
there.
attend.
If it
يعني
is, it will be a local
food-
policy. It
free
will be
food.
a local policy because our
يعني انت
patients
مع البول يا اخي عسكري
local policy.
والله انا احب العسكري ما ابي لعب احد جاء حطها بوليسي
Local policy and special restricted to our hospital with
our
patients.
department ما لي علاقه بالاقسام الثانيه
I mean with our patients, with high risk patients.
Yeah, that's what I thought.
Yeah.
It's a different issue that all.
This you need to
all
discuss
patients
مع
have.
الراديولوجي ديبارتمنت.
لا مو شباب
ما أنا دخل فيهم.
لا بس انت هتزور له في اليوم ممكن تجيب له 20.
مطلوب له
عادي.
No, it's we tell them if we have a.
هو هيوافق في البدايه في
We are
بس
dealing with
الناس
simple,
تقول لك سمعت صباح.
simply treated pathology which can
يا عادي.
cause
المهم
lethal complication by
هذا ممكن
simple.
تجي بي بي اي صح تسخن فيزيك
ممكن.
مين يشيله؟
Or the other option is that's what
يقول
I.
لك يقول لك انت جيت
لا انت
If they are worried about
هو عنده رد هي يقول لك والله جاء الدي في تي بعد ما جاتني
السيلولايتس
وانا ايش عرفني؟
انا اقول لك
يقول لك لا ما
The
في
established practice is the enforced restricted requirement is that you, if they can't do 24-hour Doppler, you can start first do the flex.
we can and bring that next time
Next working day.
you're with policy or leave it to the physician
الكلام كله في النهايه
يلا خذ رأيك.
Policy?
يا جماعة.
Policy.
policy define